Hello, everyone. Thanks for joining us today. My name is Alyssa Glenn, and I'm the Director of Community Health and Nutrition at the Greater Cleveland Food Bank. I'm joined today by an all-star group of panelists to discuss health equity in Cleveland and Northeast Ohio and the ramifications of COVID on health equity. I'm going to take just a quick minute to tee up the topic of health equity. The Robert Wood Johnson Foundation defines health equity as when everyone has a fair and just opportunity to be as healthy as possible. They go on to say that this requires removing obstacles to health, such as poverty, discrimination, and their consequences, including powerlessness and lack of access to good jobs, fair pay, quality education and housing, safe environments, and healthcare. In Northeast Ohio, we see the effects of health inequity in many ways. Our disparity in infant mortality is one of the worst in the country, with Black babies in Cuyahoga County dying at 4 times the rate of white babies. Within Cleveland city limits, it's even worse, at 6 times greater. We also see disparities in life expectancy, with some highly segregated neighborhoods in Cleveland experiencing average life expectancy as low as 65 years of age. Compare that to some suburban neighborhoods just a few miles away that have average life expectancy as high as 88 years of age. The COVID-19 pandemic has also highlighted inequities and inequalities. For example, in Cuyahoga County, while 35% of the population is Black residents make up 40% of all COVID diagnoses and 45% of both hospital and ICU admissions. Here to discuss the complex issues of health equity are 3 passionate and knowledgeable panelists, including Dr. Greg Hall, Ms. soon-to-be Dr. Frances Mills, and Dr. Jim Mysak. Dr. Hall is a primary care physician who has practiced in Cleveland, Ohio for over 25 years. He is the board president of the Cuyahoga County Board of Health and past chair of the Commission on Minority Health. He is also a published author, having written Patient-Centered Clinical Care for African Americans, a concise, evidence-based guide to important differences and better outcomes. Dr. Hall also serves as faculty at both the Northeast Ohio Medical University College of Medicine and Case Western Reserve University School of Medicine. Ms. Frances Mills serves as the Health Commissioner of the Cleveland Department of Public Health, through which she oversees the work of disease surveillance and epidemiology, emergency preparedness, nursing, health centers, vital statistics, Healthy Cleveland, and the Office of Minority Health. She has also served as a director of the Office of Minority Health since 2016 and has held multiple key positions in the public and nonprofit sectors in roles including substance abuse prevention, alcohol and drug treatment, mental health, homelessness, and crisis and trauma services. Ms. Mills is also a doctoral candidate in his ABD Alba dissertation at Ashland Theological Seminary in the area of transformational leadership. Finally, but not least, we have Dr. James Mysak, who is the medical director of the Metro Health Systems Institute for Hope. HOPE stands for Health, Opportunity, Partnership, and Empowerment. The Institute leads Metro Health's comprehensive, coordinated commitment to identify and act on social determinants of health as a critical component of achieving optimal individual community health through effective partnerships and programs, education, training, and research. Dr. Mysak is also a practicing physician of family medicine, is the Vice Chair of Community and Population Health in the Metro Health System Department of Family Medicine, and is an Assistant Professor of Family Medicine at the Case Western Reserve University School of Medicine. Thank you so much to all of you for joining us today. And just a reminder for those of you who are watching, please, as we have our discussion, enter any questions you may have in the Q&A box at the bottom of your screen. So to get started with our first question, I would love to ask all of you to take a few minutes to answer. In your work, how do you see the state of health equity in our region? What does it look like for you? And what is your role through your work or your organization in trying to create health equity in health outcomes? And Dr. Hall, I'd love to start with you.
Thank you. It's a long answer, right? There's a lot of issues. Health equity overall has gotten worse over the last year and a half. Things have gone in the wrong direction, and I think it's maybe it's just that we're seeing that things are worse, or that they've been bad all along, and we just uncovered how bad they've been. But the issues related to, I think the central issue is trust. We were having issues with people trusting the vaccine, number one, trusting health experts, trusting their doctor, trusting their hospital system, trusting government, trusting the CDC. So all these issues with trust mean when we're in the middle of a pandemic, we have to be able to give a message that's trusted so that people will hopefully follow our instructions. And what we're seeing is that there's significant earned distrust, at least among the African-American population, earned mistrust, and that now that mistrust is in the way of us all, be living in a safer community. And so I've seen issues just because of the pandemic with my patients related to, being able to get their screening colonoscopies or mammograms or chest CTs to screen for cancer. So that means that we're going to be just diagnosing cancers that are more advanced because of their inability to get screening, or some of my patients are using the pandemic as an excuse to not do what they probably weren't going to do anyway, which is get some of the preventative care. There are people gaining weight over the last year and a half, and I know I have, but just what we're calling it pandemic weight. And there's less activity, less going out, less walking, less exercise. And so with these issues of related to trust, we're trying to get the information out about, people don't trust the COVID vaccine, for example. And I say, I'm president of the Cuyahoga County Board of Health, so I'm looking out to make sure we're not doing anything detrimental to the African-American community just because I'm African-American, right? And so, but people don't know that we are positions of influence, that we are looking out for our community and the entire community. And so that sort of puts us, again, sending a message that could make us all healthier, worse. And so the health equity, I can't think of a time in recent years where it's been worse. And I think we're going to just see that poor, worse control of chronic diseases, things of that nature. And so I know at the Board of Health, we've been very deliberate about trying to make sure the vaccine is accessible to all communities. We're very deliberate about that. I've speaking of instances like this, just really trying to get out there and be in front and say, the vaccine is safe. It's really amazing. It's really going to be a turning point in medicine. The technology that they're using, at least the messenger RNA technology, and so we're going to see a lot of advancements in medicine related to that. But people are still hesitant because it's it's quote unquote new. So there's a lot of work to do, and we're looking forward to partnering with whomever we can to try to get the good message out.
Well, I agree on many of the points that Dr. Hall made. Things are looking worse than they've ever looked before. But from a minority health perspective, things are really just the same. I think what COVID has done is illuminated folks to the reality of health disparities, racial inequities, health inequities that have been going on. Just in the numbers that you cited at the beginning of the program is indicative of how bad things have been for quite some time. When we talk about infant mortality, this is an issue that has been illuminated in the last 5 years in our community, but it has been an issue over the last 5 decades. And so different things come to the fore when a light bulb turns on for someone. And so disparities as it relates to COVID turn the light on for a lot of people in that, how did things get so bad? Why are communities of color so much more affected than their white counterparts? Well, if we put infant mortality, lead poisoning, chronic disease, obesity, community violence, all of those issues have been issues for communities of color that have been really bypassed. And so COVID has been just as predictive as any other of those chronic health conditions. You could almost say when COVID hit, we know who's going to be affected the most. When we talk about the city of Cleveland, 66%, if you're talking about African Americans, Latinos, Asians, the refugee community, 66% of the cases represented by COVID, those communities bear the burden of that disease, but they also bear the burden of heart disease, cancer, diabetes, and stroke. And so where are health equity efforts in our region? I think really just beginning, because people are beginning to see that there's a problem. And in the past, people, we like to point to the victim. Well, if those people didn't do this, then this wouldn't be the outcome. Really, health equity is starting to look at what are those conditions. You gave a very eloquent definition of health equity at the top of the program that said the attainment of the highest level of health for all people. Well, when we're talking about health equity, we're talking about the assurances of those conditions that create good health. And so that may mean different things for different populations. And so we're just beginning to really have significant and meaningful conversations about health equity. And so I'm looking forward to how well we use the lessons of the last 18 months in terms of going forward, how we begin to better fund public health. What COVID did was show huge cracks in the public health infrastructure in terms of why can't they not be as responsive as they could be. And so COVID helped that along. And so I'm anxious to see how we'll continue to move forward to begin to chip away at those inequities that lead to poor health outcomes.
Thank you. I completely agree with what's been said, that COVID didn't create health disparities, it illuminated them, and in many ways exacerbated them. Life expectancy at birth for Americans overall has gone down about 1.7 years, if I'm not mistaken, from pre-COVID to post-COVID, but that decline was disproportionately more amongst Blacks and Hispanics, 2-3 years. So the disparities were there before, COVID made them worse. So at Metro Health, what we're doing is, I think about our work in addressing health disparities and trying to bring greater health equity in 3 areas. One is access to care. We have primary care and specialty care services throughout Cuyahoga County. We are the public health and hospital system for Cuyahoga County. We have a tradition almost 200 years old now of serving everyone regardless of ability to pay. And we've certainly continued that during COVID. And also during COVID, we rapidly expanded our telehealth capabilities so that we could conduct visits over telephone and video as well as in person to address some of the disparities in access to care that were exacerbated by COVID. Second area we look at is health outcomes. Like all healthcare systems, we track health outcomes in chronic disease such as hypertension, diabetes. We look at preventive care. We look at our kids getting their immunizations, adults getting their cancer screenings. But we further break those down by race and ethnicity. So that if there are gaps, for instance, in hypertension control by race and ethnicity, which there are nationwide, and there are in our system as well, we can at least start to say, well, what can we do from a programmatic sense to address those? And finally, we're working on addressing what we call the social determinants of health, which are the non-clinical factors that influence the health and well-being of our communities, which we know accounts for as much as 80% of the health of our patients in our communities. The Institute for Hope, of which I am the medical director, was established specifically to address social determinants of health in our communities. HOPE is an acronym. It stands for Health, Opportunity, Partnership, and Empowerment. And it expresses what we're trying to do as a system as we work to meet the health-related social needs of individuals, address the social determinants of health in communities, and also look to the political and structural determinants of health through effective policy advocacy. So we still have a tremendous amount to do. And all of the healthcare institutions in Cleveland and Northeast Ohio are thinking about how not to just provide good healthcare, but how to address the inequities in health outcomes that COVID did not create, but certainly exacerbated.
Thanks to all of you for answering that question. And actually, Jim, you teed up my next question very nicely by bringing up the social determinants of health. As you know, our audience today is mostly made up of the Greater Cleveland Food Bank's various partners. So every day throughout our community, these partners are working hard to provide food to those in their community who need it the most. In this way, they're actively improving the health and well-being of the community members that they serve. So what do you think is the role of the Emergency Food and Feeding Network, both the Greater Cleveland Food Bank and our partners, in improving health equity in our communities? To open that up to any of you who would like to answer.
Well, I think just being a safety net for the community in terms of the provision of food is very, very important. But we begin to talk about food as just the bottom of the rung in terms of what are additional opportunities to be had in terms beyond that. And so what I mean by that is, okay, Greater Cleveland Food Bank provides opportunities for individuals to receive food. But then there's also an aspect of what can we provide to people that will enable them to live healthier lives. Nutrition education. What are some techniques that can be brought to the community that's been done in our community, such as community gardening, giving people food, but also teaching them how to grow their own food so that those things can be sustaining beyond what they're able to get from a church food bank or coming down here specifically. Another aspect of what food distribution sites can do is begin to consider and listen to the individuals that they serve. So often as policymakers and planners and direct service people, we tell people what they ought to be doing versus asking them, what do you need? And so that's a critical component of being able to effectively engage the community beyond the distribution of food. Because like Dr. said, there are other aspects that have to be addressed with individual social determinants of health. There are people out there who may not be able to get out to the distribution site. And so there are opportunities around transportation, opportunities around education, opportunities around workforce development in terms of you may encounter individuals at your sites who are unemployed, but they have an opportunity to learn more about what you do in the food distribution business, what you do in the health education business, and it may be a pursuit that you can offer. And so we have to begin to think more broadly, and there's nothing wrong with being true to your brand. We give out food and we do that really well. There's absolutely nothing wrong with that. But when we talk about more equitable systems, we become a little bit more broad-based in terms of what we're able to do and are at least assessing ourselves. Do we have the capacity to grow beyond our mission, or are we more comfortable in that space and we want to stay there because that's what we're excellent at? But it's always a good idea to say, how are we engaging the community? How are we involving the community in the work? And how are we assessing the impact of what it is that we do, what it is that we provide to the community?
I love these thoughts around listening to people and just thinking more broadly about how we can serve them more comprehensively from a broader perspective. Thank you. Dr. Hall or Dr. Meisel, any more thoughts?
I was going to say, love your answer in the sense that there's a lot of opportunity. People that provide, I tend to trust the people that give me food, right? I'm food driven. So, when you're in a unique position, giving out food and showing that you care and doing it in such a way to people that you see on a regular basis. And so, for us to, my number one problem as a public health official is getting everyone vaccinated right now, right? And talking to people. And so in the office, when I see patients, I can talk some of them in because they know I care for them. My patients do. But I can't get to enough people, right? I maybe convinced 2 people were there. So that's not enough for us to get out of this pandemic. And so it's important for people to talk about, yeah, I was vaccinated. No, I didn't die. No, I don't have any tracers in my arms. You know, it did well. All of my relatives really didn't even have the side effects from having a shot that some people have reported. So it's good to hear that. And so it's not like you're saying you should get vaccinated and wag your finger, but just say, well, I was vaccinated and did well. And if you don't want to talk about it, that's fine. But it's going to take a community for us to work as a community to get out of this, you know. And so people have to start talking about, you know, in the old days they didn't talk about cancer, they didn't talk about treatments and stuff, but I think we're gonna need to spend more time talking about that and working as a community and networking. And I've admitted, like, providers, we don't spend a lot of time thinking about food for our patients, which is crazy, you know, because that's the fundamental thing that keeps them alive, right? But I don't ask, you know, are you food insecure? But I should, right? And so I need your help as a provider to help people get colonoscopies and CAT scans to screen for cancer, and vaccinations and preventative health things. And then I need my providers to sort of think about, you know, the basics of having access to food and asking those questions. Are you hungry? Or how many days are you hungry? What types of food do you have access to? And then, as she said, in a wonderful way, you know, it's so important to find out, what do you need? I mean, a lot of times we're given food that people don't eat because they don't know what to do with. And so we have to ask the question, what would you do more? What would you do with, what do you need? You know, and you know, my father always said, something green, something colorful should be on your plate, right? And then those basic things I learned from my father, but a lot of people didn't learn, you know, that they need to have something green. And that relates to issues with their health and issues with cancer and issues with, you know, so we need to sort of expand the way, all of us need to expand the way we think about a healthier community, because when we get a healthier community, that's how we reach health equity.
So, you know, sitting here in the food bank right by the Shoreway, I don't think anybody who drove the Shoreway on a Thursday afternoon couldn't have been just moved and stunned by the line of cars waiting for the food distribution that the food bank did at the municipal lot. I mean, the need for food is tremendous during the pandemic. At Metro, we're committed to screening all of our patients for health-related social needs. And so far, we've screened over 60,000 people, and food insecurity is the second highest need that they report after social isolation. So the work that you are all doing to feed people is absolutely critical. And I think it really illuminates kind of, when we talk about the 3 levels of trying to achieve health equity, sort of addressing the health-related social need at the individual level, feeding people. I mean, that is so critical. But it also addresses social determinants of health, because on a community level, when people's food needs are met, they hopefully have resources that they can then devote to other needs like rent, utilities, transportation. And finally, when we look at the structural and political determinants of health, policies such as SNAP, the Supplemental Nutrition Assistance Program, is one of the most effective anti-poverty policies we've ever had. And so fortunately, as I understand it, eligibility for SNAP was made easier during the pandemic, so more people were able to continue their eligibility. So I think we can use food as kind of a prism into how a particular issue can resonate on multiple levels. We've had a long partnership with the Greater Cleveland Food Bank, both directly with food distribution at some of our clinical sites, as well as a food as medicine program, where we are using food as a clinical nutritional intervention to help improve the control of chronic illnesses in enrolled patients. And during COVID, we learned a lot. We learned that we can't just expect people to come to us. We started to deliver food to people enrolled in the program. We looked at ways that we could maintain engagement when transportation in COVID made traveling so very difficult. So I would love to say that the need for food distribution will go away soon. I don't think it will anytime soon. I think that the work all of the partner agencies and the food bank does is so critical. And it, again, really illuminates how lack of resources in general, A, manifest themselves in multiple ways, and B, are sort of cross-cutting. And that if you can address a need in one area, perhaps you're alleviating stress and pressure in other areas as well.
I just want to amplify one thing that you said there that just really struck me, and that's that of the 60,000 people you screened for social determinants, the number one need you found was social isolation, and the number two need was food security. And that's just very striking, and it makes me think that when people are coming to access food resources, that they may very well have a social need that comes along with that. And that's something I think all of us can really keep in mind when people are coming to access food. So my next question for you is, as a region, are there any big wins we've experienced on the health equity front? Some positive things that we could keep in mind to build on?
Well, I think we've worked very hard at the city level and at the county level. We work together very well, and I think we've really, for it being a pandemic that no one was prepared for, I think we handled it remarkably well. There've been, overall, it may seem like the message has sort of changed, but we've been following science the whole time, and it seems that the things that we had in place, sort of have helped. We've had a whole pandemic strategy, this for the 10 years that I've been on, there's been a pandemic strategy that we never had used. And so we had these things in place, and we put them in action, and they worked. And so our ability to do that, our ability to vaccinate as many people who wanted. I mean, how long ago was it that people were clamoring to get a vaccine, right? People were clamoring for it, and that, there was no one clamoring. Everyone who really wanted it got it within a couple months. And so it may have seemed like an eternity when we were waiting, and it was in the early spring, but to be able to vaccinate that many people who actually wanted it, and through an array of interventions, and picking people up and having satellite vaccination stops, and just being very well organized, and people had all kinds of feedback at almost every place where we were giving vaccinations, and there were hundreds of people there. The feedback I got was it was amazingly well organized. It was amazing. It was so smooth that I couldn't believe it. Mike Fitz went downtown to the Woolston Center. I thought they were speedy. It's like, you got that too quick. Did they give it to you? It's like, yeah, we went right in. We got this shot. It came right out. So I thought that was really, really well organized. And so, Cleveland is really a medical capital in the United States, and so we've got a lot of smart people that have a lot of things in place. So we made some remarkable progress with that, but just sort of uncovered a whole lot of other issues as we've mentioned. And again, with the county and with the city, funding, people sort of like, public health is not really a priority. It hadn't been, right, for many years, we would see it sort of erode even every year. Wow, do we really need, emergency vaccination plans? Do we really need this? Do we really need that? Do we really need contact tracing? And now we've sort of, oh man, do we need all those things, right? And the capacity to do those things in a way that really a lot of people hadn't imagined. So, I think we've certainly shown that we were prepared as much as you can be for something at this level. I mean, both the city and the county level, and we've shown that we can adapt, and we've shown that we can listen. And so I think those are a few of the things that we've done well.
I agree, if only we could sustain the level of collaboration that has been started with COVID, because traditionally we've been a very siloed system. It's been the medical system and the public health system and the nonprofit system. And so we're forced to really, for the sake of the community, really begin to talk to each other in more meaningful ways. And so that's been a win as health equity efforts begin to ramp up. The second thing that's been a win is the willingness of policymakers to declare racism as a public health crisis. We saw that done with the city of Cleveland in 2020, followed by Cuyahoga County later on in 2020. And so the huge capacity of being able to name racism as an issue is almost unheard of. 10 years ago, 5 years ago, if individuals really pressed the issue of racism, it would have been enough to clear a room, but it's been fairly evident across the board as we work together on community health needs assessments, on community engagement, that racism emerged as a huge issue in our region. The second thing that Dr. Hall referenced in an earlier question, that the level of mistrust in our community is something that has to be overcome. And so just the idea that we could name something in with honesty and integrity and transparency and willingness to own the issue and begin to collaborate at higher levels, I think are huge wins. If we are to confront health equity, if we are to address racial equity, those things have to continue. Beyond the declarations that both city and county have established, I think each entity, I know the city of Cleveland has established an Office of Health Equity and Social Justice, just beginning to ramp up, that's working with external partners to really answer the question, what are the policy issues around racism in our community, and how is racism manifesting in the medical system, in public health, in criminal justice, in education. So all of these things impact health outcomes, but it also promotes social justice if we're able to address racism as a process and also from a policy perspective. And so there's some things that we must do in that process. We have to value people equally. But we also have to understand and realize that there have been historical injustices that need to be addressed, as well as current injustices that need to be addressed, as well as looking at how we proceed from a planning and policy perspective using an equity lens. What are the impacts of these decisions? Well, who are they going to impact? And what are those impacts anticipated will occur with those various populations? And so those are some early wins that we have, but so much work needs to be continued in order for us to get quick wins, midpoint wins, and long-term wins in terms of reaching positive health outcomes, achieving health equity, and achieving racial equity in our community.
Yeah, I couldn't agree more. I think that there have been some real wins in terms of collaboration between the healthcare systems and the public health agencies, especially around COVID testing, COVID vaccination. I know we at Metro Health collaborated very closely with the city and county public health departments to get vaccinations into communities where they were most needed and not expect people just to come to where we were. And I think that it certainly opened the eyes of, I would hope, a lot of my colleagues in healthcare of the importance of public health to contribute to the health of communities. You know, without a robust public health system, a lot of what we do in healthcare, the effects are diminished. So we like to say in the Institute for Hope that we think the P in hope should be twice as large as all the other letters, because partnerships are what really, really matter in addressing issues of systemic racism and health equity. And I think that as we, you know, think together, sort of, you know, at that up, what it means to move upstream for a healthcare system, going from, again, health-related social needs at the level of individuals, social determinants of health at the level of communities, structural and political determinants of health at the level of policy, that we can really start to ask questions like, well, how does systemic racism manifest itself in policies? And really start to think about consequences and effects as opposed to intent. And I think the more that we can do that, the more we can collaborate around common agendas that really will improve health equity and reduce health disparities.
Okay, I have one more question and then we can open it up to Q&A from the audience. So please, if you have questions, enter them in the Q&A box at the bottom of the screen, and then we can start asking those questions of our panelists. But my last question for you, and you kind of introduced this topic already. We know that the root causes of health inequity are deeply rooted and complex and include factors such as structural racism, the history of racist public policies, including housing discrimination and redlining, and unequal allocation of power and resources. This reality can feel daunting. So what can each of us do, whether it's us individuals in our daily lives, whether it's in our interactions with our communities, or through our work, to help move us as a community towards health equity?
Okay. We go first every time.
Well, one of the things that we can do is really make ourselves more knowledgeable about the inequities that happen in the community. You know, parents having conversations with their children about people don't have the same advantages that you may have or the same opportunities that you may have. One of the things that is most apparent in our community is income inequity. Why is that? Asking questions around what do you know about race, making people aware. One of the things that we do with the Office of Minority Health is we operate out of 4 core competencies. One is raising awareness and providing education. The second is around partnerships and engaging community. And then the 4th competency centers on identifying and addressing policy. On a personal level, most people, when they begin to think about inequity or racial inequity, they think it's personally mediated, and certainly it is for some people, but what we need to be most concerned about is what happens institutionally and what happens from a structural perspective. And so beginning to, if you're a policymaker and you're in planning rooms and you're in policy development rooms, beginning to say, looking at who's in the room. Who's in the room? Is this a diverse group of individuals who are in the room making decisions and planning? Where's the community represented? How do we move forward? So asking who's in the room. The second thing is doing what we mentioned previously, identifying what are the consequences and the impact of the decisions that we are about to make or the decisions that we have made. Who's going to benefit from these decisions? Who is going to be harmed by these decisions? And so we have to not only address it personally or institutionally, we also have to address it politically as well and become more civically minded and civically knowledgeable about what's happening in our community and making ourselves and lending our voices to issues that appear to have an element of social injustice in them. And so 3 levels that we can engage: personally, institutionally, and structurally between systems is how we have to address it. And to not be afraid to call something out that looks like an ism. Is this racism? Is this gender inequality? What is this? Being brave enough to call those things out, because if it remains covered, that's where the ism grows and sustains itself. And so being able to call it out, but also being willing to address it, that's a risk that we take personally, that we take in institutions, but it's something that has to be done.
I agree completely. That's you know, and one of the things I'm trying to realize is that if you see structural racism or you discover structural racism, it doesn't mean you're a racist. It doesn't mean that you have to feel defensive about something. I've made decisions at the hospital level and look back and say, wow, that was a very biased decision that I needed more input, right? And if we need more input, you're vulnerable enough to know that you need more input. When Dr. Mills said, who's in the room, but who's not in the room? How can we make this decision about someone and we don't have a representative of the decision we're making about in the room? And so being proactive, you can't necessarily have one of everyone in the room, because the room's too big, decision making is too hard. But really knowing that who is this decision about, and do we have all the input that we need in order to make a balanced decision? And even at the state level, there have been decisions like putting health equity in all decisions. You think about, how is this bus stop going to impact health? Or how is this, the structure of this building? Is this handicap access? What are the issues with the sidewalks we're doing? So really just thinking about the health of the community is our basic thing. Eating, breathing, drinking water, these basic things. And so it's not crazy to put health equity in all decisions, in construction decisions, in garbage pickup decisions, because it impacts it, all those things all around. So it's important to just look at what you've done, and even if it was your idea, it can be a bad idea now. You can identify, say, well, maybe the intentions may have been good, but the outcome may have accidentally not been good. And be willing to say, okay, maybe we should tweak this. Even though it's my decision, I'm not so sure about it now, because that having the strength and the centeredness to be able to do that, because we're all just trying to make the world a better place, right? We're just trying to leave it better than we found it. And so there's no sense in digging in on some decision you might have made that may have been a negative. Let's look forward and see how we can make things better.
I don't think I have much to add to that great wisdom. I think for me, what's been helpful is I learned from one of the authorities in this area to just ask the question, how is racism at work here, in whatever situation we're in? Because then it takes the emphasis off of what an individual thinks or feels and looks at what's going on, the stuff in front of me, and if racism is at play, how's it playing out? So I found that very helpful, in addition to, for me as a white male, being honest about my own privilege and how it's influenced my, what I need to do to change. And taking seriously once you know better, do better. It's not just a head game. That really seeing the world differently obliges us to act differently in a way that hopefully makes justice. And finally, this is all about being a part of something bigger than ourselves. None of us are going to dismantle systemic racism. So where can we join with other like-minded people to engage in work that's bigger than ourselves? That's where I think the real hope comes from.
Thank you. We have just a couple of questions that have come in. The first question is, how can agencies, our partner agencies and food distribution centers, promote more equitable access to food and health resources?
Well, I'll take a stab at that one based on our experience. I think number one, when are you available? That, hours that work for us may not work for the communities we're trying to serve. And that could be a real burden, especially on smaller agencies. But to think about, well, how are we available? When are we available? Number one. Number two, how are people treated and greeted when they come to us? We all strive to treat people with respect. Are we walking our talk? Those are things that I think would really, that I think I find helpful thinking about. I certainly think about it in clinical care. Are we treating people with respect? Are we working to deliberately undermine the racist ways people are treated, and especially when I work? So I think those are some of my thoughts about that, and I think they apply to any human service endeavor.
I'll share a story with you that I heard from an individual who receives food regularly from a food pantry. And she described to me the difference between receiving food from her neighborhood food pantry versus receiving food from a Jewish food pantry. And the difference, she said, was this: When I go to my neighborhood food pantry, the individuals who work in that food pantry, they try to tell me what to select, what not to select, what's good for me, what's not good for me, what I should and should not be doing in terms of my dietary choices. But when I go to the Jewish food pantry, they say the only requirement that they have is that I wear a head covering and that I can come in and I can select what I want. I can select if I want apples, I can select as many apples as I want. If I don't want the protein that's being offered, I'm not judged because of it. I am free to make my own choices, and I'm treated with that utmost level of respect that I would want to be treated if the position was changed. And so the way that we treat people, that is what they're going to remember, the way that we make them feel. And so those are the things that are very important when engaging the community. And to really, again, I can't say this enough, what is it that you need? Asking that question, even if you don't have the solution yourself, but to have the capacity to point an individual in a direction that may be helpful makes all the difference in the world. How we treat people and how we handle them. We have to handle them with the utmost of care.
And one additional thought is trusted partners. So I find when I'm in my office and I'm talking to a husband and I'm getting nowhere. I said, "Where's your wife?" And she, she's in the waiting room. Bring her in. And so because you need a trusted partner in this message giving, right? And so if you're going into a community and you don't have trusted community members who can kind of tell you the lay of the land, what's going on, you're at a disadvantage. And then, there's data that shows that, providers, if you're in a Latinx community and you're a white physician, you've got to have Latinx employees, medical assistants. So if you're in a Black community, you need to have some Black employees because that helps you build trust. And so again, as we go into the community, make sure that you've got a part of the community invested in what you're doing, because that's how you kind of get buy-in. People want to see people that they know that kind of say, this is okay. And then at that point, then the advice you give is okay, right? If this person's okay, then they're maybe better able to say, you may not want any green vegetables, but you should take some, and here's why. Everyone can't give that advice. You have to be a trusted person. Will you tell me what I can do, what I can eat? So it's like, but in the end, we nutritionists know that might be some advice that they actually need, but you have to earn their trust. You have to be almost introduced to them by someone that they trust. And so by using trusted partners, you can kind of help send those messages home a little bit better.
It seems like a good time to mention that one of our earlier sessions was on trauma-informed care and had some really just excellent thoughts around communicating with people and how to really help people who have a background of trauma, which one of the things that came up is that many of us do. It's much more common than many of us would think. So if you haven't seen that session, I'd encourage you to watch it. I learned a lot that I think I can use in my life. Okay, our last question. What kinds of resources are out there that our agencies and partners could take advantage of to learn more about health equity and just what's going on in our region?
If we're talking about COVID-specific resources, Cleveland Department of Public Health, Cuyahoga County Board of Health have resources available that will answer questions about COVID, frequently asked questions. What is COVID? What are the vaccines? Making sure that contact your Board of Health, contact your Cleveland Department of Public Health, and just request information. We can provide that information to your food organization that you can distribute. in packages, not just COVID-specific information, but information about other chronic diseases is also available. Information about how to get involved in community-based processes that are related to health equity and racial equity. And so it's just a phone call away in terms of getting information. If you want individuals to come out, if you have a program component that's related to your food distribution, call us. We have individuals who will come out and provide presentations almost on any health specific topic that you might want to consider, or we can point you in a direction if it's an area that we don't specifically deal in. We have huge collaborations in the community across the hospital systems, FQHCs, that we can be of service to you. And so making information readily available to people. Where's the next clinic's going to be for vaccination? And might be one in your neighborhood. Call your board, call your health department and say, can you send us your calendar of vaccination clinics that you're going to be scheduling over time? And so there's the information, and then there's the educational aspect. And then there are opportunities to become involved if there's a policy area that you're interested in. We have a program called Healthy Cleveland that is really our health promotion arm for the residents of the city of Cleveland, that focuses on discrete areas like healthy eating, active living, community violence, tobacco-free living. So call, get information, get involved.
And it's all great advice. And you can call, I just had to look it up, call the Board of Health at 216-201-2011. And that for people who aren't savvy with the internet and kind of want to talk to someone, their ability to do that is possible. But you know, there's a ton of resources about COVID, a ton of resources. What's that? It's like 211. There's that you can call, just almost ask any kind of issues, and they can direct you to the blank 11 that you need to call. And so you know, there's a lot out there. Don't be afraid to call for help. You know, people sometimes think there's no one out there to help, and we find that there are people out there that are getting help just because they asked, right? So it's important to know that we are all fallible, we all have issues, we all have fears, and we all have questions, and there are people out there that have the answers, or at least some array of answers that you can choose. And so don't be afraid to reach out and see what you can do. Thanks.
Yeah, I think it's really important to reach out to trusted sources of information, especially now. City and county boards of health are great sources of information. All of the major healthcare systems have websites with lots and lots of information about various health issues. In terms of issues around racial equity, many employers are engaging in diversity, equity, and inclusion efforts. You can inquire about those at your place of business. There are racial equity training workshops available through various organizations. So there's a lot out there. My plea would be that people use trusted sources of information, because I think accurate information that's trustworthy is so important to get us out of where we are now to where we need to go.
All right, well, we're at the end of our time, so I'd like to thank everyone for watching and being wonderful partners of the food bank. We appreciate you and all of your work. And I would also like to thank all of the panelists today for coming today, and also just for your incredibly challenging work over the past year and a half. I can only imagine what it's been like to be on the forefront of public health and healthcare provision throughout this pandemic. So thank you to all of you, and I hope you all have a very lovely beach vacation sometime in the future.
You too.